So infectious disease specialist Dr. Ruth Berggren from UT Health San Antonio is joining us to answer our viewers' concerns. So first of all, Dr. Berggren, thank you for joining us on this morning. And let's go ahead and start with this question. What happens if people don't get that second dose 3 weeks after getting the first shot?
There will be no guarantee that you're protected. And so what we know is that you're really best protected 1 week after your second dose. Your second dose comes 3 weeks after the first. So if we also know that the vaccine is not 100%, it's 95%. And there's no way to know whether you're going to be one of those few people in the 5% that aren't protected.
Okay, so of course there are some people who are skeptical about the speed in which the vaccine was created. They are nervous and some want to wait until maybe the following year. What would you say to those folks? And as a matter of fact, correct me if I'm wrong, but I do understand that you will be one of those frontline workers who will be getting that vaccine this coming up Wednesday.
That's right. I signed up for it just as soon as it was possible to sign up for it. And I think I'm getting it on the first day that it becomes available at our Health Science Center. So I'm very excited about that.
Okay, so what do you say to ease, those concerns, that so many people still have about the vaccine?
Well, so I think what makes people nervous is the speed with which it was developed and the fact that it's a different kind of technology. And I would say to reassure them that the technology has been under development for 3 decades. It wasn't invented yesterday. It was the work that had gone before that permitted scientists to respond rapidly when the sequence of this virus was first published in early January. The whole genetic code was known. They were able to act extremely quickly and plug the information from the genetic code into a mechanism for vaccine production that had already been under development. And so it seems like it was something where people got a flash of a brilliant idea, snapped their fingers, and bada bing, bada boom, we have a vaccine. But the truth is that the studies and the science was ongoing for many, many, many years. And I'm a believer in that vaccine science because I've had a chance to review it.
And Dr. Berggren, we want to include our viewers into this. So we did ask some questions, and one of our viewers, Manny Almaraz, he's asking the question. He wants to know, do people get some kind of card to track that they've received the vaccine?
So there's a lot of paperwork involved with this vaccine, actually. There's like 3 different consent forms. There is an immunization tracking program that the government requires. This is for safety. If people have an adverse event, they want to be able to track it back to which batch of vaccine did that person get. And then I've been shown an image of a card that has the CDC's emblem on it that will be given to me after I get my vaccine. So this is the tracking that we know about.
Okay, now we know. Also, another viewer, Jose Caballero, wants to know, why are these vaccines not being administered to minors 16 years and younger?
So that's coming in the future. The problem is that with any new technology, people don't immediately start enrolling young children in clinical trials. Now, we do have data, limited data on young people in the 16 to 18 year age range. And for this reason, we are able to give the vaccine to anybody 16 years and older. What I heard from the presentations online that were made to the FDA is that the vaccine is being studied in the 12 to 15-year-old age group right now, and that when Pfizer goes to apply for their biological license in April, that they will be applying for licensure for kids as young as 12. And we can expect, based on history with prior vaccines that have been developed, that gradually over time, we will get enough data about younger and younger age sets to where children will be approved for this as well. I want to add something that's really related to this, which is that we have some data on pregnancy and the vaccine, but not a lot. The data that we do have is encouraging enough that many obstetricians are advocating that pregnant women get the vaccine, especially if they're in an at-risk group, such as a healthcare provider. So that tells you something about the confidence with which we're approaching this vaccine.
Yeah, that's right. So much still to learn, and it's just a work in progress. Dr. Berggren, thank you so much for your time this morning. We know it's been a hectic day, so thank you. We appreciate your time.
Happy to be with you.
Thank you.